Welcome to our community health assessment project. Our focus area was in Mecklenburg County, Charlotte, North Carolina, and our focus group was the homeless population. We're concerned about the health outreach to them currently in that community. This is presented by Marcia Algood, Andrea Richardson, Brian Abrahamson, and Teresa Balzer. So the population of homeless people in North Carolina is about at the national average. North Carolina has a very high population of people, but it doesn't have an overly abundant amount of homelessness. Most of the urban areas carry the highest number of homeless population, with Charlotte being the highest. Andrea Richardson completed the windshield survey of Charlotte. She was able to drive through it, mostly central Charlotte, but she was able to hit some of the other areas as well. The housing, there's not a lot of property per house, and there are a few areas that are more poorly maintained, which would be lower income areas. Some of these areas would be a focal point for homelessness. There's not a lot of open spaces in Charlotte. There are a few, and we'll speak about those in a little bit. There are high mass transit in the area. There's a large airport. There's a lot of common areas in the city, especially where people can gather, and there are a few parks and restaurants. There is also a big concert venue. The area is very well maintained. Charlotte is a very clean, well-maintained city. The signs are clear and obvious, even though at times there can be a lot of them. And there are many stores, a lot of areas for income for the city. Grocery stores, restaurants, a lot of clothing stores as well. The politics in Charlotte is pretty comparable to most other places. A lot of government offices and areas for voting and taking care of your legal needs. There are also meetings that are held regularly, and there are many that have to do with safety and housing and economic decisions that impact homelessness very directly. One notable thing about the media area is the public libraries, and these libraries can be used as a health resource, especially for us as nurses, to provide information to those that don't have it. In the business and industry, there are a few large companies. Two of note that I would point out is the Carolina Healthcare System and the Novant Health. Two large healthcare systems that can pair with the community to help resolve the issue of homelessness and getting them healthcare needs. There is a diverse population in Charlotte. No main one area. It is mostly white, but there are a little bit of everything in there. And the religion is pretty spread out as well. As we spoke about the large Carolina Health System, along with the Novant Health, and there's a VA hospital. The VA hospital can be very important to serving homeless population of veterans. There are also many dental offices, mental health, smaller companies that can be used to help the medical side of the homelessness. Marcia Algood was able to interview Anne Marie Elmayan, who is a volunteer coordinator at the Men's Shelter of Charlotte. She gave us a lot of very good information. The Men's Shelter houses about 300 to 500 men each year, but it provides help and resources to thousands of homeless people. It doesn't just supply to the men that they house. The Men's Shelter operates two shelters, actually. There are two in the area. The one is on Tryon Street, and then others on Statesville. Tryon would be the main location where you go for initial assistance. Their philosophy at the Men's Shelter is income plus housing plus support equals home. And how they do this is pretty interesting. They help a homeless person improve their job readiness, allow them to gain employment, and then they provide housing, either Section 8 or low income, or in finding rentals for them. And then in this way, then they are able to support them on the long term via services like substance abuse, mental health, and even the men helping each other with peer support. And they also do provide medical respite. And it's very important as healthcare workers for us to work with places like the Men's Shelter of Charlotte to provide that medical and healthcare respite. Teresa Balzer was able to complete a secondary data analysis of the Mecklenburg County homelessness. Some very sad numbers here. 4,700 homeless children enrolled in the Mecklenburg schools. This is some data that we pulled out. Of note, there are two things here. 10% of the population in Charlotte is chronically homeless, and that will become important in just a minute when we talk about something else. The other thing I wanted to point out, 32,128 low-income people filled out applications in just 5 days to get on a waiting list for Section 8 housing in 2014, yet only 400 get vouchers yearly. That is a sad and low number of people that get housed in Section 8. And they are working on creating more Section 8 housing in Charlotte. So the chronically homeless people utilize 50% of the homeless resources available. And remember, chronically homeless was only 10% of the homeless population. So that's a very low number of people that are using a lot of the resources available. The cost for community care, if a homeless person is on the street, is $40,000. If they're in supportive housing, Section 8 or low income housing, it only costs $14,000 for the community to support them. So there is a huge emphasis in Charlotte right now on getting people into housing, in which that'll lower costs and allow us to use it elsewhere. Thankfully, between 2015 and 2016 and into 2017 as well, there has been a notable decrease in homelessness, and that has continued over time. There is thankfully a awareness somewhat of this problem, and it is changing. We decided on 3 health diagnoses. The first would be ineffective health maintenance, especially related to vaccinations and immunizations. Many of the homeless people just don't have access to this stuff, and it is an issue that needs to be resolved. Hopelessness. Really, many homeless people either start a substance abuse and alcoholism, or they are abusing an alcoholic, and then it leads to homelessness. So there is a long-term stress and abandonment that comes in homeless people that is evident over time. Deficient knowledge. Because they're homeless, their focus is not on, let me go look at all the options out there. They are just trying to get by day in, day out, and they're not familiar with what opportunities they have. So our primary interventions would relate to immunizations, seasonal flu, hepatitis B, pneumonia, screening for STDs and blood pressure, things like this that would be helpful in allowing homeless people to reach some of those necessary vaccinations and immunizations. There are clinics and hospitals that will work with local organizations to make this possible, and it needs to continue. Secondary intervention, we want to intervene on a personal level with the homeless. We want to figure out what their coping strategies are, and if it is to rely on substance or alcohol, then we need to be able to help them change their behaviors by providing medical and psychological alternatives. Doctors and nurses, psychologists, social workers, many people can be involved. We can also involve the community via volunteer services and programs like that. Our tertiary intervention focuses on education, educating not only the homeless people but also the communities in which they're in. We talked about some open areas in the city of Charlotte that could be used for a health fair. We can hand out flyers directly, and we can meet the homeless people where they are. We can make them aware that, hey, we're here, we're going to help you. You know, we have these opportunities for you to be able to get the health care and medical attention that you need. This is a huge effort. Many volunteers would be needed, and that would not only need to be medical staff. There could be volunteers from the community, normal, everyday people that are willing to help. This has been an excellent learning experience for all four of us. The homeless population is a very needy population, and they don't always come after the resources. Sometimes they need to be brought to them. As nurses, we're in a prime position to reach out to a homeless crowd, especially focusing on medical attention, immunizations, things like that, that we can use. Prevention, intervention, and education are essential to continuing helping Charlotte, especially decrease homelessness in the community. I would encourage you all to look at your own communities where you are, because there are homeless people in every single community in the counties of North Carolina. It's very sad. In my county of Alamance, there are 144 homeless people, and I've seen them on the streets before. We all need to work together collaboratively to end homelessness, and that way we can provide quality patient-centered care to all the people in our communities. Thank you very much for listening to our presentation. I hope this has been beneficial to you.